going to be talking today about poo and bums. Please excuse the pun, but both are the butt of many jokes. We all have one and we all perform the action of pooing daily. So why is it something that we make a laugh of or find more embarrassing than other activities? If you have a disorder of the bowel, then let me assure you it's no laughing matter. Here comes another pun. It really is a pain in the ass. I don't know what it was like in other parts of the world, but where I grew up in Ireland, appendicitis was a big thing in the 70s and 80s. Every week a kid would be off school and hospital with it. It was as common as the flu. If you hadn't had your appendix out, it was guaranteed that you had rumbling appendix at least once or twice. Any disturbance of the bowel seemed to be classified as something to do with that, which was thought of back then as a useless part of the intestine. By the mid-90s, the term irritable bowel syndrome seemed to start floating around, and rumbling appendix was a thing of the past. Then you either had appendicitis or irritable bowel. Laxatives were prescribed like candy. Even enemas like Microlax were being used daily by those who had a diagnosis of irritable bowel. The first time I heard of Crohn's was in the noughties when my cousin was told she had it, and it was considered a rare condition. Now there are thousands of people who suffer with it, and there is a whole family of chronic illnesses that are categorised as IBS, inflammatory bowel disease. I'm not going to go into all of them as I don't have enough knowledge, so I'm going to talk about Crohn's, which is also categorised, and a particular form of Crohn's that is still not very well known about. It's called perianal Crohn's. The first documented case of perianal abscess and fistula disease, or perianal Crohn's, dates back to the 1600s. It was Louis, the Sun King of France, that became the first patient to undergo surgery for this condition. It was groundbreaking for the time, and to this day the same procedure, albeit now with anaesthesia, that is still performed today. Crohn's disease is an inflammatory condition, but in perianal Crohn's, the inflammation is in the anal and genital area, not further up in the intestines. No one is sure why you develop it, but I'm certain constant use of laxatives and chronic hemorrhoids are a contributing factor. When you think of an abscess, you usually associate it with teeth or gums, but one of the most common symptoms of perianal Crohn's is developing perianal abscesses. The first time you get one, you have no clue what it is. I thought mine was a really bad dose of piles. But an abscess is an infection, so unlike hemorrhoids, it gets worse and worse if untreated, and eventually will get into your bloodstream, making you incredibly ill, with flu-like symptoms, headaches, high temperature, etc. It won't go away without antibiotics, and worst case scenario, it can cause sepsis, which is life-threatening. In fact, 53% of people who develop sepsis die. With perianal abscesses, they respond slowly to oral antibiotics because the tissue that is infected is in a remote part of the body, and because it is very hard to keep that part of the body sterile. Every time you use the toilet, you are in essence adding more bacteria to the already infected area. IV antibiotics are more effective, but many times a perianal abscess has to be surgically drained. This isn't just a needle to remove the fluid inside, it's actually surgery in a theatre where they cut it open, drain it and remove infected tissue. While that might be the end of that particular episode, people with perianal Crohn's get these abscesses again and again. This leads to the formation of a fistula, which is a minuscule tunnel, perhaps the size of a needle, that opens from the external abscess site to the internal intestine or vaginal wall. Bodily fluid escapes into the tunnel, and after the exterior wound is healed, it gets trapped, causing more infections and excruciating pain. It can be cut open or a drain put in, but the success rate for cutting it out is very low, so most end up with a permanent drain or colostomy. These constant surgeries can eventually damage your sphincter muscle, so that you neither can push out or hold in. In essence, you are incontinent. Not only being an incredibly painful condition, it has a serious effect on your mental health due to the psychological effects of trying to manage your illness, the fear of sepsis, and the social aspect of being incontinent, and having an illness that is embarrassing or something that people laugh at. People with perianal Crohn's will tell you it rules their life. Before undertaking anything, you must first assess the situation from the perspective of your toileting. This can be as simple as a night out where toilet facilities may not be readily available or hygienic. Long car trips, holidays, etc. are all a challenge, and you can't do things that others take for granted. Every time you use the toilet, you need to have washing facilities, as the risk of getting bacteria in that area is very high and almost always leads to more infections. You can't avoid using the toilet, but when it is something that becomes almost a phobia, it's something you have to cope with every day. Perianal Crohn's can also spread to other intimate areas, and then it is called genital Crohn's. You are unable to shave and have to wear sterile underwear. Sex is a challenge to sufferers too, as many find that any sexual activity triggers it. People don't talk about what's wrong with them out of embarrassment or fear that they won't be understood, so it can be very isolating and lonely. There needs to be more education, even amongst medical professionals, about how debilitating this condition is. Why can't we live in a world where we don't have to feel ashamed of our bodies? Where we can feel accepted even if we have disabilities, no matter where they are? Where the body is neither seen as a sexual object or something that has to fit a certain aesthetic criteria. Where it is seen as what it truly is, a shell that houses who we are. We all have the same biology. That's not what makes us who we are.